So I'd like to welcome everyone to this policy lab, which we're doing entitled Unpacking the Commercial Determinants of Health. You can see our program summarised there with Etty, WHO starting, then Belinda Townsend, Lacey Nichols, Julia Anaf, and then Sharon Frill joining us as a panellist. Just by way of introduction, I expect everybody will be answering this question anyway. What are the commercial determinants of health? That really we were paying attention to the commercial determinants of health throughout the century, through the European Industrial Revolution, with examples such as Engels in his UK observations in conditions of the English working class, and of course Virchow in Silesia, looking at the impacts of certainly commercial determinants of health in that setting. We then, of course, Ilona Kickbush really brought the term to widespread use when she defined it as the promotion of products and choices that are detrimental to health. And just recently, a group in Victoria, De Lacy, Borden and Livingstone, have defined these three main understandings. When, as a good or service where there's an inherent tension between the commercial and public health objective, health outcomes from a profit motive, and of course the promotion of products and choices that are detrimental to health, which was Ilona Kickbush's original definition. So we'll be exploring that through case studies, observations and the broader global environment today. I'm particularly pleased to welcome you to this webinar because it's the first one since we were designated as a WHO collaborating centre on the political and commercial determinants of health. And because it's that momentous occasion, I've asked Etty and Krug from WHO to make a few introductory comments. So I'll hand over to.
Well, thanks very much, Fran, and good morning to all of you here in Europe, and good afternoon to all of you over there in Australia, and something in between to everybody who's somewhere in between. Welcome to this important discussion on what I think is a very important topic, social determinants of health in general, but more specifically commercial determinants of health. And I want to thank the Southgate Institute for organizing this discussion. As Fran said, they've just become a WHO collaborating center on the social, political, and commercial determinants of health equity. And so this is kind of the first event happening in that context. We're more and more aware of the impact that products and approaches used by the private sector have on health. And this impact is huge. It can be positive, and I think it's important to recognize that at the beginning of a discussion like this, we wouldn't be able to have a webinar like this if it wasn't for the private sector, the innovation, the research, the investment that they have done. So I think we need to recognize the many positive contributions the private sector is making. However, all too often health is being sacrificed for corporate and commercial interests. We're all surrounded by products or marketing for products that are well known to have a negative impact on health, and we have to talk more about that and address it. This is particularly important for non-communicable diseases, tobacco, alcohol, foods and beverage, energy industries, of course, come to mind when we think about that, but not only NCDs. It's also important for injuries when we think about vehicles, sports equipment, firearms, alcohol again. And it's also important for a range of other health topics, mental health, for example, with the gambling industry, or all the negative impacts on the environment, which again has impact on health. So I think we're talking about a huge topic that has a huge impact on many, many different aspects of public health, and which we haven't understood fully. So I think an event like this, where we try to unpack it, understand it, and discuss what we can do in order to promote pro-health behavior by the private sector is extremely important. We at WHO certainly recognize it more and more. This is why we've designated Southgate Institute as a collaborating center, but we're also starting a new program on the commercial determinants of health. We are finalizing a first recruitment, and hopefully in the coming months you'll hear more from us on that topic, because we are fully aware of the importance of it. So thanks for having me, and I certainly look forward to the discussions today. Thank you.
Thanks very much, Etienne. I really appreciate that. And it's really encouraging to hear that you are developing the WHO Division on Commercial Determinants of Health. Well, without further ado, I'd like to introduce our first speaker, who's Dr. Belle Townsend, who's a research fellow in what we call in RegNet, which is the School of Regulation and Global Governance at the Australian National University. And she's also Deputy Director of the Menzies Centre for Health Governance at ANU. And Belle is going to talk to us about unpacking trade and investment agreements as commercial drivers for non-communicable diseases. And I just add that, like me, Belle has been a very active member of the People's Health Movement, where she's been one of the leaders of the work that the People's Health Movement has done on trade and health. So over to you, Belle.
Thank you so much, Fran. Can you hear me okay?
Very well, I can.
Okay.
Yeah.
All right, so hi everyone. As Fran mentioned, I'm going to be speaking today about trade and investment agreements as commercial drivers for non-communicable diseases. So first I'm going to give you a bit of background on trade agreements, then I'm going to focus on a select number of examples about how they can enable NCD risk factors. And then I'm going to focus on some findings from case studies in Australia where we've looked at what are the conditions that can enable or constrain getting governments to pay greater attention to the potential health impacts in their trade policy making. So just first off, for those of you who are tuning in or you're listening to this recording of the webinar, a trade treaty is between two or more countries on the rules governing their trade. They're often preferential, meaning countries are giving each other better access to their markets, and they generally include dispute resolution. So if a country is perceived to be to have breached the agreed trade rules by another country. An investment treaty is an agreement establishing the terms and conditions for private investment by nationals and companies of one state into another. And trade and investment agreements can be bilateral, meaning between two countries, or they can be between larger groups of countries, either multilateral or regional. And I think an example of this is the Comprehensive and Progressive Agreement for Trans-Pacific Partnership, or the CPTPP. I've just got a photo of the signing of this agreement in 2018. It's a big mega regional trade agreement in my region that involves Australia and 10 other countries. And we've seen a proliferation of bilateral and regional trade agreements proposed and negotiated by different groups of countries since the stalling of negotiations at the World Trade Organization. And with this turn, we've seen an expansion in the number of issues and domains covered in trade treaties. They now go beyond merely negotiating tariffs on goods. They include things like provisions to protect investor rights, extend intellectual property rights, remove what some corporations might see to be pesky government regulations or barriers to trade, and they can include many other issues. So just by way of example, this was a mapping of agreements involving countries in my region in 2015, and it really highlights the significant number of agreements that there are between different groups of countries and how there can be overlapping, the overlapping nature of those agreements. I think it's important to say at the outset, and something that Etienne mentioned as well, is that trade can have positive impacts for health. And we know, for example, in the country that I'm from, Australia, that we actually rely on trade for good quality imports for products for our health system. So to the extent that trade can improve access to health promoting goods is a good thing. But there can be potential negative impacts, and that depends on the provisions that are included. So an example that many people would know of that's been in focus in the last few decades is the potential impacts of intellectual property rules that can extend monopolies on pharmaceuticals and thus delay the entry of cheaper generic medicines, which can affect access to medicines. There are rules on what corporations might argue to be barriers to trade, and this can have an impact on the scope of public health regulation. And so an example of that is that we've seen more recently disputes and disagreements over alcohol labelling between states at the World Trade Organization. We've also seen that trade liberalisation can enable greater access to health harmful products, and I'm going to speak about a few of these in a minute and some of the evidence that's come out in the last few years. And then there are other concerns around rights for investors and how the rights for investors to sue a government through a mechanism called investor-state dispute settlement might create concerns for public health regulation. And there's a lot of debate about whether we have the capacity to have adequate safeguards in these kind of mechanisms to protect public health regulation. There are a whole other range of issues and concerns that come up for health, but today I'm just going to focus on a few examples and some of the evidence around NCD risk factors. So, as Etienne mentioned at the start, we know that unhealthy diet, harmful use of alcohol, and tobacco use are some of the risk factors for NCDs, and that NCDs are now responsible for more than 70% of deaths globally. So if we take the example of sugar-sweetened beverages, the graph that you're looking at here, and I'm sorry that it's a little bit faded, it's examining sales of sugar-sweetened beverages and other ultra-processed foods in Vietnam before and after it lifted restrictions on foreign investment in the beverage sector after it joined the World Trade Organization. It was one of the requirements for Vietnam to join the WTO. Colleagues who ran this natural experiment design found that sugar-sweetened beverage sales per capita rose significantly after it lifted the FDI restrictions, and that's this darker line up here. And this was primarily attributable to products that were manufactured in Vietnam by foreign companies. More recently, there has been a systematic review of quantitative studies of the health impact of trade and investment agreements, and that's been led by Pepita Barlow. And that found that implementing trade agreements was associated with increased consumption of processed foods and sugar-sweetened beverages, and was correlated with higher cardiovascular disease incidence and higher body mass index. If we examine the case of alcohol, Australia's defence of its plain packaging legislation against both, If we examine the case of alcohol, my colleague Ashley Schramm recently led the first longitudinal analysis of the impact of preferential trade agreements on alcohol imports, examining Australia and 15 of its trading partners. And the analysis found that introducing a preferential trade agreement was associated with a statistically significant increase in the share of Australian alcohol beverage imports in the partner country's total alcohol beverage import supply, and that the effect was mainly from trade in new alcohol beverage categories. What was interesting about this analysis, which was published earlier this year in Addiction, is that the preferential agreements had greater impacts in low consumption countries. And so the study really points to the need for analysis about what the new alcohol beverage categories are that are entering into these countries. Many of these are countries in Asia and the Pacific, and what the impacts on health might be, especially if these are countries that have historically had low levels of alcohol consumption. So in the case of tobacco, Australia's defence of its plain packaging legislation against both state and tobacco company disputes is quite a known example in global health. And here many of us know about the case about the tobacco giant Philip Morris, who initiated a claim of hundreds of millions of dollars in compensation, claiming that Australia had breached an agreement with Hong Kong and expropriated its intellectual property when we introduced our plain packaging. This case took 7 years, and in that time, some governments, such as New Zealand, withheld introducing plain packaging, waiting on the outcome of the case. And this phenomenon is called regulatory chill, that even if a government isn't being sued, it can have a chilling effect, or the threat of a case or the case in another country can have a chilling effect on public health regulation elsewhere. So we know that Philip Morris eventually lost the case because it was found that they had shifted their headquarters to Hong Kong after Australia introduced our legislation to try and take advantage of that agreement. But we know from a Freedom of Information request that the cost to Australia was more than $23 million just to defend this one case, and that Philip Morris was only ordered to pay half of this. So a question for public health is, what are the conditions that might enable or constrain governments from paying greater attention to or even prioritising the consideration of the potential health impacts in trade agreements? So to investigate this, I interviewed 25 key stakeholders in Australia in relation to our participation in the CPTPP agreement that I mentioned earlier. And I think the first thing to note is that there are a lot of challenges. We know that there is a kind of dominant neoliberal market framing within government, and in particular within thinking about trade, that permeates the way of thinking about the purpose of trade agreements. And this is within government, it's within industry, it's within our mainstream media. The processes available for public health advocates to influence negotiations appear more skewed in favour of industry. So a trade official that I spoke to said trade agreements are for industry. And so industry actors often have access to informal and informal processes to influence the negotiations. And while public health actors also have access to some of these processes, they have been much more critical of a perceived lack of substantive engagement with government, in particular when the public health objectives clash with offensive interests. And so by way of example, in Australia, we have alcohol and sugar export offensive interests. And so it can be quite difficult to get government to think about what the health impacts of those might be. And then finally, we know that there are power asymmetries within government. I think this is another telling quote from a health public servant who said, and I quote, "The health officials have to take as gospel the word of the trade officials. You know, if a trade official says, well, this is the legal impact of the course we're negotiating, then health officials have very little capacity to engage in that discussion." Having said that, what we found from our interviews was that two issues did appear to get onto the Australian government's negotiating agenda in the CPTPP. And these were domestic concerns around access to medicines and tobacco control. And this was in contrast to other health issues like alcohol harm, nutrition and healthy diet, which really didn't appear to get onto the agenda. And from the analysis, we identified 16 conditions which appeared to influence whether or not government was going to pay attention to these health issues. And this is from a framework by Schiffman and Smith that we used, and then drew out the conditions from there. So if you look at the top left-hand corner, these included the actors involved. So we looked at the strength of exporter interests, the export industry, the relationships between those industries and government, the extent of trade minister and health minister support for that particular issue appeared to play a key role, as did whether there was support from other actors, not just health actors, but other economic actors who are willing to voice support. And then the extent of pre-existing networks and health advocacy networks that were aware of some of the issues for the trade agreement was also an important factor. If we think about the example of tobacco in Australia, we know that Australia had no tobacco manufacturing, and what we found from the interviews was the health minister really took on tobacco control and made quite a conscious effort to engage the trade minister on this issue, which helped put tobacco onto the agenda for the negotiators in Australia. In the bottom left-hand corner, we can look at the role of ideas, and we know that ideational factors were also important. So the ability to frame a health issue in different ways played a role, as did the history of preceding trade treaties and the available knowledge of what was in the agreement. Sorry, that's my timer going, so I've only got a few more minutes to go. If we look at the political context, we found that the support from major political parties was important. Having events that happened outside negotiations that drew attention to the health issue, and the Philip Morris case was highlighted by a lot of informants as being able to crystallise to them what some of the health concerns were. Informants identified the strategy of advocates who were able to move between and use formal and informal processes inside and outside the negotiations. And they were able to do that very effectively around the issue of access to medicines. That was highlighted as one of the reasons why that got onto the agenda. And then the public support for the issue. So we found that in Australia, there is strong support for Medicare, and that was highlighted as an important dimension for why they were able to generate attention to the issue of access to medicines. And then finally, in the bottom right-hand corner were the particular NCD characteristics that informants spoke about. So they said that it mattered what the strength of the evidence was on the issue, and that included the health evidence, the economic evidence, and the ability to use evidence and link it to stories. So for example, the stories of people who were suffering from cancer and the fact that they couldn't access medicines that they needed to. The presence of existing domestic legislation was highlighted as important. So the fact that Australia had Medicare, we had plain packaging legislation, and that we'd signed on to international treaties like the Framework Convention on Tobacco Control, whereas we hadn't had such sort of strong commitments nationally and internationally around nutrition, for example. Overall, what we show in this paper that's just come out with IGHPM is that despite the challenges that we find in this area, that we have had some successes in generating attention to health in trade, and this is important for tackling trade as a commercial determinant of health. Okay, so I think I'm out of time now, but I just wanted to provide a link to some of the references that I've cited in the presentation, and also just wanted to acknowledge my colleagues Ashley Schramm, Samantha Badams, Sharon Friel, Fran Baum, Ron LeBonte, and Deb Gleeson, who have done a lot of work within this area. And I'm looking forward to the discussion after the other presenters. So thank you.
Great. Thanks very much, Belle. That was really beautifully presented and very clear, and a great introduction to one of the big sort of scoping issues that shape the commercial determinants of health in terms of trade. We will give everyone a chance. How we're going to handle questions is ask people to type them into the chat as we go, and then we will have hopefully around 5 o'clock we will be able to then throw the questions to the panelists. So our next speaker is Jen Lacey-Nichols, who works at the University of Melbourne in the School of Agriculture and Food, which is in the Faculty of Veterinary and Agriculture Science. And Jen is going to talk with us about the good, the bad, and the grey areas. And it's really about that weighing up that Etienne referred to earlier. You know, how do we weigh up the harmful and healthful practices of commercial determinants of health? So over to you, Jen.
Thanks, Fran, and thanks very much for having me here. I want to say I love this topic, but I'm always very conscious to say I love the topic, but it's a bit of a love-hate because we are talking about the commercial determinants of health here. So, of course, there's a bit of frustration as well. I'm hoping, for those who know me, to potentially raise a few provocative issues here. If I don't raise anything provocative, I'm very sorry. I haven't ticked my own personal box. I like to start out with some fun facts and context. So this is my little brush with the commercial determinants of health. For those who can't tell from my accent, I am from the United States. And this is an example of some of the preemption strategies we're seeing from the soft drink industry, who are trying to avoid some of the state-based taxes against them. So they sent out in their ballots essentially trying to put in legislation preemption so that states down the track won't be able to legislate and develop sugary drink taxes. For those who are wondering what this has to do with sugary drink taxes, groceries here is the euphemism for sugary drinks, which is quite clearly designed to mislead the voting public. So that's our fun fact there. There we go. So as a little bit of context setting, I put this slide together a few months ago to try to get my head around the commercial determinants of health in this space. And I'll say, you know, we've started out with Nick Freudenberg's corporate disease promotion back in 2005. I will say in hunting through the literature on this, it goes much, much earlier than this. The first sort of mention of this industrial epidemic, commercial determinants of health was actually in occupational health, and it had to do with repetitive strain injury. And so even then we can see very early on, we're talking about harmful business practices. And I'll come back to this question of whether we're looking at practices versus commodities and some of the challenges there. But I thought it's useful to sort of see, just as Etienne noted in the introduction, as did Fran, there's a plethora of terms out here. There's not a lot of consensus. I'm a fan of the term I've just come across from another researcher in this space. We have a shaggy body of literature in the commercial determinants of health space, which I think captures that quite well. But what we tend to see with a lot of these terms is a focus on unhealthy commodities. In a sense, this is very understandable. A lot of the researchers in this space have come from tobacco control. They have a lot of shared learnings, and to an extent, this idea, the premise of the commercial determinants of health in some ways comes from tobacco, and this idea that, of course, there are shared market strategies and shared political strategies across tobacco and alcohol and ultra-processed foods and pharmaceuticals and the gambling industry and the sugary drinks industry, etc. We have all of these shared things. We've learned quite a bit from this focus on unhealthy commodities, but what we're talking about now is this need to sort of move beyond this particular focus. So this is a very ugly slide. It's very text dense. I apologize. The only thing to pay attention to are the bits in blue. So I've pulled out some of the definitions from all of those different concepts from the previous slide, and you can see that the vast majority of them really tend to focus quite a bit on that unhealthy commodities. Yes, we're talking about other things as well sometimes. Certainly, Jahil's definition around those industrial epidemics, we're also talking about job conditions, and we're talking about environmental pollution. Nick Freudenberg's definitions tend to be a bit more expansive here as well. And certainly, Ilona Kickbush's framework sort of points to some of those more systemic drivers in the system. But by and large, what we see is a dominant focus on unhealthy commodities. And what I'm going to talk about in my next few slides is why I would argue this is limiting and problematic in several ways. And, you know, I'm not saying anything new in this space a little bit. Other people would very much agree that we need to move beyond this focus. But starting to have this conversation, we're not quite there yet. So these are my 3 arguments for why a focus on unhealthy commodities is problematic. So the first one, which is probably quite obvious to everyone in this space, is this idea that when we're talking about unhealthy commodities, for the most part, they're harmful because they're harmful to consume or ingest or use. And fundamentally, there's a role for the consumer or the individual in that particular action. While in public health, we certainly emphasize, of course, the role of environments and circumstances and the systems that shape and drive all of those individual behaviors. Fundamentally, there is some individual behavior wrapped up in these consumption acts. And so this very much risks then that personal blame and responsibility narrative that we have seen ad nauseum from all of these industries across the board. And so I would argue that to some extent, the focus on unhealthy commodities is a little bit corruptible or a little bit amenable to some of that industry counter framing and that industry framing to sort of shift it into that individual blame space. It's a little, you know, it's hard to make some of those counter arguments. And, you know, however much we talk about, you know, the social determinants of health and those upstream drivers of this, the industry very much is quick to come back and say, well, no, it's just individuals, etc. So that's argument 1. Building on that idea that commodities and that focus on unhealthy commodities are amenable to industry sort of tinkering and reframing to fit them in. One of the things that I looked at quite a bit in my PhD is the industry's sort of, we are part of the solution response to obesity and CDs, etc. So I looked quite a bit at the sugary drink industry, but we see this pattern not just in soft drinks, we see this in the food industry, as well as in alcohol, tobacco, and other companies or other industries, where as companies face pressure from public health organizations, pressure from markets changing their demands, and the threat of government regulation, we see them strategically diversifying their portfolios and reformulating their products and portfolios to shift away from this. So if we look at Coca-Cola, for example, we can see that they have an enormous amount of bottled water in their portfolio. From a health perspective, we can probably agree that water is healthy. Environmental questions about bottled water, of course, a slightly separate question there, but they are moving into juice, they're moving into flavored water, they're moving into dairy, into milks, into all of these other products that are incrementally healthier, shall we say, than sugary drinks, but fundamentally avoid then the question of, do we need to reduce consumption of these products? Do we need to change the business status quo? Should we be reducing consumption and the sale of all of these branded products? This allows them to continue increasing their revenue, continue increasing their market share. Certainly a pattern we've seen in the ultra-processed food world and I guess ultra-processed beverages as well, is that as wealthier nations' markets get saturated and face all of these regulations, we're now going to be moving into the global south as well. So progress in some countries can perhaps, export the problem elsewhere. So if the nature of the problem of commercial determinants of health is linked to these harmful commodities, it raises difficult questions to answer sometimes. For instance, what is a healthy product? In the world of food and nutrition, this is very much debated these days. Is it a nutrient focus, ingredient focus, level of processing? Is it the ubiquitous new product development that goes on? If we're trying to change these corporations and the commercial determinants of health, what % of their portfolio needs to be healthy? Are we weighing up, at some point when it ticks over into a certain amount of water or whatnot? How does that work? If we're talking about transnational corporations, what is the focus of that analysis? Is it national? Is it global? It's challenging. And if we're going to put in all of these different metrics and weigh up to what extent corporations are health promoting or health harming, because as Etienne said, not necessarily all economic commercial factors are harmful. Certainly at a basic level, having employment is good for public health, as we're all learning through COVID. Where do we put in labor conditions or gender pay gap or the privatization of public goods and services? Where do we draw the line around mapping out what is potentially harmful or healthful with these corporations? My final limitation is this question of, if we're looking at commodities, we're not really necessarily looking at the size of the corporation. And so it's that question of, are big and small businesses equally harmful? And this is a little bit what that industrial vector of diseases and that vector framework sort of pointed to, which is this idea that the larger you are to an extent, the more you're sort of amplifying that capacity to do harm. And so in the world of COVID right now, we're certainly seeing a lot of examples where some of these industries are taking advantage of COVID as a marketing opportunity. Alcohol industry has certainly seen this come out. If I pull on a local example from Australia, we can see Craft Cartel here, which promotes independent breweries. We've got some free shipping in Australia, keep buying Australian, buy local, which is very much a sort of marketing thing right here. Support your local industry, support local business, jobs, etc. Being a fan of craft beer, I can tell you that some of these are very high in alcohol content. But the question is, do we consider these small, micro, independent alcohol producers that alcohol, has health harms associated with it? Do we put them in the same box as AB InBev, which is, the world's largest beverage corporation? A lot of our focus in the commercial determinants of health space is especially around these corporate political strategies, the way that they're trying to block or influence the development of healthy public policies. AB InBev has far more political and market leverage than some of these very small actors. If we think about what Bell has been talking about with the trade agreements, we're not talking about tiny mom and pop organizations influencing these. We're talking about major multinational corporations. So where does scale and power fit into this question here? And certainly the question of power has very much become part of that agenda and that conversation with commercial determinants of health. So I would argue that it's perhaps a little bit more useful when we're trying to think about what are the commercial determinants of health and what makes them harmful, to put power at the forefront of that conversation. This could include attention to how much revenue they have, how globalized they are, their market concentration, access to big data, media influence, political influence, etc. So Milliman, for those who don't know, is an American health insurance company. We don't necessarily put health insurance usually into the category of commercial determinants of health. They've received some negative press about a partnership in 2017. This is me cherry picking one example with LexisNexis Risk Solutions. That's a big data corporation. And they are using clinically validated social determinants of health data to help give insights about their clients, which, according to some fairly grim investigative reporting, is essentially allowing these corporations to avoid providing health insurance to vulnerable populations, which is, of course, a huge health issue. And that raises the question, where is this conversation around, the use of these powerful corporations shaping all of this, or even, the privatization of what probably most of us in Australia and many other countries would just consider to be a public good, health insurance. So I think I have 2 more slides, almost done. This comes back to the big picture question of what do we want to change? If we acknowledge that the commercial determinants of health are driving health inequalities, sometimes they're promoting health, sometimes they're promoting ill health, there are a whole range of different things that we could focus on. And most of what we've looked at so far in this commercial determinants of health literature tends to be the 2 columns on the left. We're looking at unhealthy products and tweaking ingredients, nutrients, processing, perhaps the promotion dimensions around that. We're looking at all of their political strategies. And these are, to an extent, quite easy and discrete things to research. They're more visible to an extent. Once we move into the 2 columns on the right, and apologies, I've put this together. There's probably some blurring between there. I'm sure we could have some argy-bargy about whether, international trade and foreign direct investment are more of a systems issue versus means of production. Sorry, bear with me with my clunky table. These are much more challenging, diffuse, tricky things to think about. And this is sort of where we can sort of see Ilona Kickbush's framework sort of pointing in this direction of drawn my very ugly arrows to sort of map this out. If we think about those unhealthy products, that's sort of the marketing dimensions of this. Political strategies, that's your lobbying and corporate citizenship. We've got the supply chain, sort of means of production, and then all of those drivers, those big picture things, that's your sort of market political system. But I would argue, if we want to address the commercial determinants of health and improve all of this, tax havens, for one thing, would probably be much more impactful to deal with than tweaking the particular ingredients of product portfolios of corporations. Full disclosure, I'm very cynical about product reformulation as a solution. Blame my PhD. So my last sort of slide to come back to the theme of this is this question of, as we start to grapple with commercial determinants of health, and as we're sort of thinking strategically about how to understand them and what we want to achieve with this focus on commercial determinants of health, it's really important to be careful about thinking about what do we want to weigh up and how are we weighting the different things that we weigh up as well. Are there some things like slavery in a supply chain that are so deeply egregious that absolutely nothing positive could compensate for that? I've thrown some general things into my visual down here. So hypothetically, we could have a corporation with high market concentration, poor labor conditions, lots of ultra processed foods in their portfolio, and they're exercising all kinds of political influence to block policy. Not great. On the other hand, perhaps they have great gender balance in their business leadership, and they've got a very sustainable supply chain, and they also have lots of healthy foods in their portfolio. How do we weight these and weigh these up? My favorite local example For the Australians is that Sportsbet is a major sort of gambling company, generally recognized as like a really good place to work, but it's a gambling company. So that is all from me. Hopefully I've said a few provocative things, and I look forward to the questions down the track.
Great. Very much.
I think I'm on time.
That was really good, and I think you're certainly provoking everybody to think. And I think it's a nice lead into our next presentation, which is from Dr. Julia Nath, who works with me at the Southgate Institute, where we've been trying to do that balancing through applying health impact assessment to corporations. And Julia's going to draw on some of that work, but particularly focus on corporate strategies to shape public perception on health and equity issues. So over to you, Julia.
Well, good afternoon, everyone. Within this broader discussion on the commercial determinants of health, I'll focus on just some of the ways in which transnational corporations shape public perceptions about health and equity issues. And I'll place this within the context of the work that we've been doing in the Southgate Institute at Flinders University. We've been conducting corporate health impact assessment across a range of industry sectors, including fast food, looking at McDonald's in Australia, the extractive sector, looking at Rio Tinto in Australia, South Africa and Namibia. And this is just to give a little bit of a comparative analysis between a high-income country in Australia and the two middle-income countries. And now we're looking at Carlton and United breweries in Australia. And our work is guided by a corporate health impact assessment framework. And what's on the screen there is highly simplified, but it's just to show you that we look at those three levels to assist with our analysis and to come up with the cumulative health and equity impacts of the particular corporation. But I'll focus on a little bit just on level B. And this is because we identify at this level a wide range of strategies to promote a corporation's overall best interests when we map both the positive, we're always looking for the positive and negative aspects of political practices, their business practices. You can see on the screen a few there, products and marketing. But I'll turn now to some of the strategies identified in the wider literature, which are used mainly to help shape public perceptions about health and equity issues. So what are these strategies? Well, we've got using front groups, masquerading there as grassroots alliances. Corporations know how to capture civil society and the media. They can, divide and conquer their opposition. They shape knowledge and research through their own scientific advisory boards, fund health professional organisations, of course, and of course framing issues in a very positive light, or on the other hand, knowing how to deflect unwanted attention. And of course, we know that corporations discredit their critics and manufacture doubt about science. And I think we can think here about the issue of climate science at this point in time. And some of these strategies have come to light in our own research, but I'll speak briefly about 4 others that we came across in doing our health impact projects. These are the use of creative and integrated forms of marketing, corporate social responsibility initiatives, a corporate philanthropy, and strategic industry alliances. So turning briefly to creative and integrated marketing, this slide really just shows the very sophisticated avenues for marketing or cross-promotion especially with the evolution of new online platforms. And it, of course, allows for marketing and presenting products in a very favourable light. But turning to an example from our own research around creative marketing, it's the juxtaposition of these two products. On the left is a 6-pack of full-strength beer, and on the right, one of an alcohol-free version available on supermarket shelves. And as you can see, they're dressed in the same corporate livery here. And while zero alcohol options can obviously help a person monitor their overall alcohol intake, this type of creative marketing has been roundly criticised. Firstly, it's seen as targeting children and young people as future adult consumers of alcohol. And secondly, that it seemed to target adults themselves under the banner of health-focused consumerism, even though, of course, even alcohol-free products can act as psychological triggers for certain vulnerable groups. And this creative marketing shapes public perceptions about a product known to impact health and equity. The second example of these 4 strategies I mentioned was the use of corporate social responsibility initiatives. And these seek to add value to a corporation's activities by ensuring that it is not focused only on the economic bottom line, but that it also makes a positive impact on society, the environment and the economy, sometimes referred to as the triple bottom line. But now we hear more about a corporation creating shared value. Now, different initiatives provide a range of positive contributions, possibly community education or sponsorship, but there's a definite tension here. Positive publicity may divert our focus away from harmful aspects of corporate products and practices, deflect attention from the need to enact statutory regulations in place of voluntary codes, possibly, mandating stronger front of pack labelling, and it thereby dampens down incentives to better protect public health. And also, corporate social responsibility can expand corporate marketing reach and product acceptability by associating it with an image of social commitment. And I'm thinking here too about the ability to attract the best employees within a corporation, as many may wish to only identify with the corporation with some form of social commitment. And now, to give one example of these inherent tensions that I've just mentioned, the following slide provides reflections on a particular foundation which was set up as a corporate social responsibility initiative. And these reflections come from a research respondent based in Southern Africa. As this person said to me, yes, there are positive things and it would be unfair not to talk about them. The foundation is doing a lot for young people. It has national sports events so that many people can take part. It also provides them with computers or whatever is needed. But after a little while, and reflecting on the influence of the publicity and reporting around corporate social responsibility, this person went on to say, yes, that's the pages and pages of what they all do, but it's also the white cloths they put over the dirt. And as an aside here, but also to stress this particular point, I note Rio Tinto's recent intentional destruction of the Jukan Caves, a 46,000-year-old Aboriginal heritage site in the Pilbara region of Western Australia. And we can contrast this deliberate action with the many positive sustainability and corporate social responsibility statements on Rio Tinto's website. One of these states, and I quote, From the start of our operations to their closure, we aim to thoughtfully steward the land on which we mine and on which we operate. The third example of influencing public perceptions highlighted by our own impact assessments was through corporate philanthropy. Now, of course, corporate philanthropy can provide funds for positive social investment. However, one business strategy is to align a corporation to a cause, a social or a health issue, and this is known as cause marketing. Ronald McDonald's publicly funded, or largely publicly funded, Ronald McDonald House Charity markets the cause of supporting the health and well-being of children. However, corporate philanthropy can help to deflect public criticism, for example, by cleverly using an ambassador for health, a clown mascot, to market unhealthy food to children. And turning to an example related to our own McDonald's project, the following slide juxtaposes a concerned paediatrician with the smiling and welcoming Ronald McDonald clown dummy. This specialist, with whom I was in correspondence during the McDonald's project, is a strong advocate against fast food, calling it a key vector of childhood obesity. And the bench on which both are sitting is obviously designed creatively for marketing and promotion opportunities, and is permitted to be placed in the foyer of an Australian children's hospital. Now, I'd argue this is a key way to shape public perceptions about food products that have health and equity impacts. Finally, our fourth example about perception shaping is through strategic industry alliances or partnerships. And as we know, peak bodies are organisations which represent the best interests of an entire industry or community sector. And this slide is just part of a much larger visual representation by one industry sector, it could be any, I guess, on the value of a particular corporation investing in becoming a corporate partner. And as we can see, this is to gain access, advocacy and influence in respect of government. And by making direct representations to government, these bodies allow a corporation to strengthen or at least maintain their best interests while remaining a little bit at arm's length politically. There's also the capacity for different industry bodies and other related entities to work side by side strategically to ensure consistency of the approach and messaging to government, and also helping to nullify any threats. And I raise this particular strategy because we were reminded of the examples of different peak industry bodies across different industry sectors during our work. For example, the Minerals Council of Australia, collaborating with Rio Tinto and BHP and others to successfully lobby and repeal the mineral resources rent tax, which would have given at least some money towards health and social investment in the community. So the favourable public messaging that comes around from the lobbying also shapes to help public perceptions about corporate practices with health and equity impacts. So to conclude, I argue that a key reason why transnational corporations engage in this wide range of strategies is just to maintain their power. And their power is the power to maintain the regulatory status quo. This is what they want. It's largely a system of voluntary codes and self-regulation which underpin a global neoliberal operating environment that promotes corporate best interests ahead of health. And finally, I've just got a slide of the publications coming out of our work to date. And in these, you'll find a lot more information about these and many, many more strategies engaged by corporations. as discussed today. Thank you very much. Thank you.
That's great. Thanks very much, Julia. It's a lovely overview. Now, just before we move to questions, I'm going to call on Professor Sharon Friel. Sharon and I are co-directors of an Australian National Health and Medical Research Council Centre for Research Excellence on Health Equity. And the work that Bell did, some of that came out of our CRE, and the work that Ashley Schramm did. So we've asked Sharon just to sort of make some comments drawing on the three presentations about the commercial determinants. So over to you, Sharon.
Thanks, Fran. And I suppose, first of all, a huge congratulations to Fran and the team and the WHO Collaborating Centre. I mean, I think so vitally important, and that really I extend thanks and acknowledgement to WHO for recognising how important this issue really is. And then also just as people have been doing as we've been going through the talks, sort of, the thumbs up and the little claps for Bell, for Jen and Julia, who have laid out really beautifully, I think, some of the challenges for us when we think about this area of the commercial determinants of health. So I suppose my first reflection, and we sort of tussle with this, we recognise that there are very good things that come out of commercial activities, of course, but we're here on this call, I think, as certainly as a public health community, concerned about the harm that it's doing we've got a tsunami of non-communicable diseases. We've got the challenges, of course, of infectious diseases that have some of these commercial interests as the drivers. And so we just think it's not right that this health burden, this disease burden continues because of these commercial activities. So I think let's not shy away from the fact that it's the harms that we want to do something about. So Bell, I think, really illustrated to us, because when Bell's talking about trade and investment, she's talking about public policy, and that's government. And so there's government policy that is enabling these sorts of commercial practices that are harmful to health and health inequities. And I think we've got to call out government policies and practices in that beautiful way that Bell did. So there's a role for government, and I'm going to come back to that. Jen, of course, always provokes us to think about some of these issues, and I thought that was a really nice way of saying to us, yep, we can have incremental change, and actually I think we need incremental change, but we can't make that the sole response. We have to think about some of the big systemic transformations that are needed. I don't think it's an either or. I think we need both. And I think if we understand the realpolitik, we will never, it's a long game. We can't get to that radical transformation overnight, but we've got to keep that as an eye on the ball. And then Julia's beautiful expose of all of those different strategies, sort of the market and the non-market strategies that we know that the commercial players use to pursue their primary interest, which of course is profit. So I suppose I want to suggest that what we heard fundamentally was the issue of power and the stark inequities, the asymmetries in power across this system. And we heard how the big structurally and economically powerful corporations pursue their interests. But we all have power, and the challenge, I think, for us is absolutely, we are not passive to all of this. We are here because we're concerned about public health. WHO has incredible power in the system. So what are the different forms of power that are at play, and how can they structurally actors recalibrate some of those power inequities. And what we heard was structural power, institutional power, and discursive power at play. That was what was illustrated by Belle, Jen, and Julia, I think. So if we want to say that, okay, well, recalibrating some of that big structural and economic power that's held by the transnational corporations, what's the role of the state? What's the role of civil society and social movements? What's the role of researchers within all of this? And what's the role, of course, of the multilaterals and the organizations like the UN and institutions like the UN and WHO, of course. And we have across the state players, the civil society players, and I would hope some of the researchers, we bring incredible expertise around institutional processes. Belle laid out how navigation took place using different institutional mechanisms to shift a positive health agenda within trade. We've seen the use of different types of evidence, so bringing to bear, I would say, for any researcher on this webinar, like, think about the sorts of questions that you ask. We have to evolve from just describing the problem. We have to ask the questions of the how you make change happen. And then, of course, the role of social movements, creating resistance, using outside spaces to challenge and shine a light on those power inequities. And I would love to see the state actually stand up and have some principles and actually say the fact that what seems to lead the charge is the profit motive over the public interest. Of course, profit is not going to go away, but it's the balance of profit over public interest. So have some principles, and WHO help member states reimagine and release those principles. And what that requires is an incredibly reconfigured regulatory framework that actually controls the unhealthy policies and practices of the corporations and elevates and makes it much easier for the healthy, sustainable, equitable models to move forward. So they were just some of my reflections of what is, of course, a huge agenda, but fantastic that we're having this webinar and really look forward to all of the work. No pressure, Fran, on the Collaborating Centre to solve all the problems.
Thanks very much, Sharon. And we've already had a conversation about how the Collaborating Centre can draw in networked researchers, so we'll certainly do that. And that was fantastic. I think highlighting power, highlighting the role of civil society. And I know some of my colleagues from the People's Health Movement are on this Zoom, so they will have been very pleased to have heard that, and of researchers, and of course of the state. What's the role of the state? So let's move on to some of the questions, and I'm just going to deal with them in the order that they came, I think. And the first one was from Anthony Sree, and he really asked, he's linking this to COVID by asking the panel, and perhaps Belle in particular, I think you have thought about this before, Belle, what are the implications, for the example of the TPP in the region, of vaccine availability and distribution? Now that's going to be a really important commercial determinant of health, I think, in the next few months. And then the second part was, would you like to comment on the free flow of health-related personnel and that implication? So there, I think he's thinking of the brain drain, I think, but you can clarify, Anthony, if I'm not right. So I don't know, first of all, Belle, I'll ask you if you'd like to address that.
Yeah, sure. If I put COVID aside just for 1 second, just because I might have some colleagues on the call from Thailand and Malaysia. So we know in the CPTPP that when the US withdrew a few years ago, some of the most controversial IP measures were suspended, but not all. And so right now there are public health movements in Malaysia and Thailand who are trying to raise these health concerns. So Malaysia signed the agreement, but has recently said it's not going to ratify, and that's because of quite a lot of mobilization by public health and other civil society groups. And over the last few months, Thailand has been saying that it's considering joining the CPTPP, and Thai health groups and farmers groups have been doing a lot of advocacy to try and convince the Thai government that it's not a good idea, and that includes the economic analysis. And so not just vaccines, but in Thailand, the big issue at the moment is the impact on access to seeds, because if Thailand was to sign up to CPTPP, would need to agree to providing patents on seeds, and that's a big issue for the farmers groups. So solidarity to any colleagues from Thailand and Malaysia who are doing a lot of work at the moment. On the vaccine, I was really, I guess I was really heartened by Tedros taking leadership this year with supporting Costa Rica's proposal that any kind of COVID vaccine that was developed should provide, I think the term was fair and equitable access. And I was just looking up recently that WHO has played a really key role in supporting low and middle income countries to push for a mechanism that would enable access. And so they say elements for an initiative should include transparency around clinical trial data, public disclosure of gene sequences, funding agreements that enable equitable distribution, affordability, and publication of trial data, and open access licensing. And so I think that if those initiatives, if the vaccine that emerges comes through that initiative, then that's an example of an international health mechanism that gets highlighted, and government negotiators who are signing trade agreements will point to that and say, this is what we need to follow. And health ministers are able to lobby the trade minister and say, no, this is what we're following. So it's a really great example of, I think, where health can be put first above profits. And then on health personnel, I haven't looked at the CPTPP text on that, but I was just thinking about the fact that there can be positive or negative impacts for the movement of health personnel. So you could have, you could meet a shortage, and that's a good thing. You could provide knowledge exchange, or you could be sending remittances back. But as Fran mentioned, one of the big concerns is brain drain, when health personnel are moving from one country to another and they lose training and public investment in those public health workers. So I'm sorry I don't have the specific CPTPP point on that, but I think that the brain drain issue is a significant concern for low and middle income countries.
Thanks, Bill. That's great. I think I'll throw the next question to Jen, which was Peter Sainsbury, and I think he meant it as a comment, but he says we shouldn't forget that the commercial determinants of health are a subset of social determinants, i.e. they are societally determined. And I know colleagues of mine from Latin America really don't like the social determinants of health. I think it should be the social determination of health. And as Peter said, power is central to their conceptualization and understanding. So does that fit for you, Jen, that we you know, Peter's argument that we should see these as part of a suite of societal determined rather than sort of putting them off in a silo of their own? I think that's what Peter's getting at. Jen, you're muted.
I forget, sorry. I would say, I think this perhaps partially prefaces the answer I'll give to Robert about future research. There's a pro and a con to both sides of this. On the one hand, of course, they're part of the social determinants of health, and of course, power is embedded in that. We've developed a lovely framework to help teach med students about social determinants of health, and embedded in that is one of the upstream drivers are the commercial determinants. So they fit along with, you know, racism and, you know, political systems, et cetera, et cetera. I think there's a delicate balancing act to be made in terms of chopping things up and siloing them so that they're in achievable, researchable chunks, but not forgetting that they are part of a broader context. So the extent to which we think about them as commercial determinants of health, slightly distinct from social determinants, so that we can have that research agenda and understand them, but not treat them as so distinct that they get put next to each other, one gets prioritized above the other. I'm not sure if I'm answering your question very well, Peter. for comment.
No. Okay. Well, yeah. Well, thanks for that, Jen. I think I think your description of the model you use for medical students sounded very interesting. And Peter's he's saying that he does agree with the Latin America in the chat. The next question is from Robin Ireland, and this is for Julia in particular, Julia. And Robin says sports sponsorship is clearly used to alter perceptions of corporations as a method of creative marketing. Terminology seems to be confused here in the literature. Is this a form of corporate social responsibility, or should we be careful in how we use the term? You need to unmute.
Yes, this is a difficult issue. Sponsorship is tied up with philanthropy, it's tied up with corporate social responsibility. I'm not quite sure how you disengage or reframe that. I'm sorry, Robin. So you were suggesting that we need another term or another way of framing this, did you?
Can I just comment and clarify my question then? Yeah, no, thank you. I think it's difficult as well. It's an area that I'm researching, but I think to use the term, my personal view is if you use the term corporate social responsibility to cover all sponsorship, I think it's confusing issues, and it's partly to do with regulation. So if I can just give a very quick example, if Coca-Cola want to give lots of Australian dollars or UK pounds to support a community sports development program, that is corporate social responsibility. If they pay multi-million pounds to have their logo on the front of a shirt, that can be controlled by regulation. So that's why I'm asking the question, because I think in the literature, and particularly around commercial determinants of health, there is no distinction, and I actually think there should be. And I just wanted to see whether anybody else had any perceptions of this. Thanks.
Thank you, Rob.
Okay, thanks for that, Robin. I think I'm just going to go on to Alison, I think, has asked us about what are the implications from low and middle income countries. And I noticed that Upendra also said in LMICs, we do find many other kinds of commercial entities that are powerful, not just because of their size money, but other aspects, including political patronage. And I wonder if I could ask Sharon just to make any comments, particularly about low middle income countries and your thoughts on that.
Yeah, maybe just reflecting on some of the work that we're seeing it within the Menzies Centre at the moment. So some of the sort of the analysis around that is highlighting a number of things. One is around the authority of health and health issues in relation to economic development, and the authority of health, the health sector, and the authority of the health issue really is not up there. And so that, of course, is a big challenge when trying to think about economic development. But the introduction of some of the evidence around the health burden and the health costs to the wider economy has been quite powerful. This is some work coming out from small island developing states. The other issue, of course, is capacity, both in terms of human capacity, financial capacity, resource capacity, to be across all of these sorts of issues when there's often positions that have sat, I'm speaking now within government, to try and build a governance mechanism to counter some of the commercial influences, and many of the positions sitting unfilled, if there are any positions to address that. And then, yes, the sort of the political patronage of, we've certainly seen in the case of tobacco that the health minister will be in a room and make an agreement with the tobacco industry to allow the tobacco company investment into the country on the condition, well, not on the condition, on the offer of sort of political support and otherwise. So challenging. That, of course, also happens in high-income countries. We're certainly seeing that play out in Australia right now in terms of all of that political patronage. One of the things, and I think it came up in the chat discussions, and perhaps who mentioned that, was the data and having data to hold account. So data at the country level, data at the company level, and then of course getting that globalized, having a system of data sharing. Some of the social movements do that quite beautifully, but how to use data to hold companies and governments to account. And I think there's some lessons to be had there from tobacco and from some of the food work that's happening as well. So maybe the person who was talking about the data might want to comment a little bit more about that from a low and middle income country.
That's great, thanks Sharon. And I think Upendra Bojan, you also made the point about data availability not being there, including mandatory reporting, is very limited. The other question that you raised, I think is really important, is that ethics regulations are yet to catch up to check commercial entities funding, influencing research agenda. I think that's a big one. I don't know, Julia, we've sort of come across that in our research. Do you want to just comment on that, the sort of blurry line there?
Oh, the conflicts of interest?
Yeah.
Yes. Well, we hear about the conflicts of interest in things like universities, twinning up with different industry sectors and blurring the lines there for research. Or we hear about corporations, one mining corporation being able to help craft the student topic guide, those sorts of things, these huge conflicts of interest in different areas. Don't know really what else to say about that, but
I think there's also an interesting conversation going on in chat, pointing out the blurriness between marketing and corporate social responsibility and forms of sponsorship, university chairs and so on. Do you want to talk to that, Jen, at all? Is that?
I mean, to an extent, I feel that it's almost just a question of semantics. The word CSR is understood across the business literature. You know, my friends who don't do any research whatsoever in this space usually know what I'm talking about when I say CSR. So if we introduce another term that perhaps is a little bit more accurate, does that kind of defeat the purpose if we want to be communicating these issues? I don't know. I mean, I think we could haggle endlessly over really accurate terms for this. But I think for the most part, everyone recognizes that, of course, CSR provides market and political benefits. Why else would they be doing it? The question to which, the extent to which it offers any sort of social or health or environmental whatever benefit is very much up for debate. I don't know, maybe that's oversimplifying it.
Well, I think you just made a great point that corporate responsibility will be paying tax and with relevant regulations, so that's an interesting point. And he suggests we reject the idea that it's anything but promotion of corporate interests. So that's a strong point. So thanks for that one. The other thing that Erica Borkales has asked is that mining and coal seem to have an enormous hold on Australian politicians. And if you're not from Australia, you probably find it very hard to know how strong that is. And the laws seem to be so ineffective here compared to the European regulatory system. Does anybody want to comment on that from the panel? But I mean, it certainly has the power, I think, of the coalition of mining and coal industries have very powerfully dominated our debate on climate change in this country, I think, to a quite huge degree.
It's not my area. Isn't it the largest contributor to our GDP though?
Sorry?
Isn't mining one of the largest contributors to our GDP? Like it's our main export, right? I think. This isn't my area. I'm just...
It's a very important one, along with agriculture and tourism, and of course it used to be overseas students, but it's not that anymore.
That's part of my response for another question.
But I think it's for me, that sort of points to another important sort of area is actually comparative research. And Julia, I don't know, people are asking about sort of corporate impacts in low and middle income countries. I wonder if you want to talk about what we found, particularly about occupational injury, when we compared South Africa with Australia with the same company.
Yes, well, the Rio Tinto project threw up the differences between things like occupational health and safety regulations between Australia, even though that's a state-based initiative, so it's not a national framework for health and safety, but it was seen to be much more effective than the middle-income countries of South Africa and Namibia that we looked at. The number of mining deaths or injuries, while they were reducing down over time and they were really being attended to, there was quite a gulf between the kinds of statistics between Australia as a high-income country and Namibia and South Africa. As other things, gender equity, I think we found was better in Australia than it was in Namibia. There were a whole raft of different things we looked at, and generally the wage parity was better for Australia. On all of these indicators, it appeared that you know, it was much better to be employed in Australia.
I mean, I think the crucial thing was it was reflecting the regulatory frameworks in Australia.
That's right.
And
also, yes, that's right. The frameworks and the corporations were only doing what they needed to do. That was as far as meeting their regulatory obligations. So Rio Tinto would meet its obligations, say, in Australia, but meet lower obligations that were set in other settings. So they didn't keep the high bar depending on where they were operating.
Thanks, Julia. In a minute, I'm going to ask each member of the panel to answer the question that Robin Martin has posed, which is what they think the future research agenda should be and what they might see as some of the barriers we need to overcome. But first, I just wonder if Sharon, you'd like to talk about this issue of finance and how it's driving a whole lot of these. So it's sort of like a determinant of corporate determinants almost.
Yeah, I just posted that because it does strike me that sort of behind many of the industries that we're speaking about, there are others, and there are these private money managers, the huge billions and billions of dollars that they choose to invest in different companies around the world. And just a little bit of work that I've started to do, which is looking at the fossil fuel industry, the global dairy supply chain, and as it turns out, they're also connected in with the tobacco industry. And I just think, and it maybe goes to your question, Robert, around the future research agenda of starting to bring those sorts of players perhaps into that commercial determinants landscape. because you know, they're shaping the direction of many of these industries and how. But of course, with the new generation private investors, who I would hope are a bit more ethically oriented, a bit more environmentally oriented, and we've seen that with some of the investment spaces. Maybe there's an opportunity to start to engage in those discussions, but I do think we need much more rigorous research in that space.
Thanks, Sharon. And I'm going to go to Belle first to comment on very quickly, what do you think is the future research agenda in this area for you?
Yep. So I was just thinking about that then, that I think some of the barriers that I'm really interested in are trying to get actors and institutions outside of the Department of Health or the Ministry of Health or the WHO to care, because I feel like we need these wider coalitions and networks. And so I'm interested in a research agenda that is about what framing strategies can we use, what are the coalitions that we can widen, noting that those coalitions should not be including corporate actors using CSR to promote their agenda. And that means we need better management of conflict of interest. And the conflict of interest agenda, I think, is one that's going forward. And then what are the forums that we can also be using that perhaps might be outside of health, but where we have allies? So that's sort of the agenda that I'm interested in.
Right, thanks. Jen, would you like to go next quickly?
Sure. You get a 4-part response, Robert. Agenda item number 1, we need to have some sort of realistic conversation about, are we talking about what's practical, or are we talking about what's optimal and aspirational in this space in terms of what we're looking at and what we're trying to achieve when we look back on this in 20, 30 years at the end of our careers, you know, what were we aiming for? Item number 2, as has been sort of flagged, it's really hard to get data in this space. A lot of it's commercially sensitive, etc. So thinking strategically. My favorite data set in this space was when Hillary Clinton's emails got hacked, and it happened to include emails between the Clinton Foundation and Coca-Cola, and lo and behold, we've got fascinating insights about Coke's political strategy around the world because the Clinton campaign got hacked. So investigative journalists for interest. Number 3, of being very careful to avoid corporate co-optation and hegemonic responses to all of this, such as we see in the energy sector, for instance, where we've got massive fossil fuel companies buying up all of the new green energy sources. So if we're worried about power and corporate concentration, we need to make sure that we're actually tackling that, and that's part of that conversation. And my last one, and this is sort of cheekily responding to Gwen's question, recognizing that these industries are not completely infallible, that they are shakeable, that they have weaknesses, that there are cracks and fragilities in their power. So strategically finding out what those cracks are and how we're going to lever them open. I can give a longer answer about what I think some of those are, but I'll hold off for now.
No, that's great, Jen. And I think you've introduced the new Zoom technique of nail points. Very effective. Yes, fantastic. Julia, do you have any points to add on the research?
Well, about future research, I think we learn a lot from the investigative journalists in this area. Not just Michael West, but the International Consortium of Investigative Journalists and what they're doing. The whole conflicts of interest that I think, was it Belle pointed out, is a huge area. And working on the alcohol corporate health impact assessment that we're doing at the moment has thrown up this huge spider web of the alliances and networks between and across industry sectors in so many different ways, where they're all supporting each other. It doesn't matter what sector you're in, it's just like a web of intrigue to me. And that seems to be a huge area of research as well.
That's great, thanks Julia, that's really good. And I just noticed we've got a point there from Upendra saying that maybe we could look at how they could promote health, what they could do. I think that could be an interesting one. Sharon, do you want to finish off with a few comments before I just wind up on the research agenda?
Yeah, if we could do nothing else, I would love to see us investigate power. Of course, we're in the process of doing a bigger power analysis within the Centre for Research Excellence on the social determinants of health equity and power being everywhere, and that's just in public policy. So I think research around power, research around different regulatory approaches, not just within government, but also the role of civil society as a third-party regulator, and then the sort of the recalibration of the policies, practices and products within the commercial world. And my final point would say is we can't talk about this as, you know, for us as individuals, what we would do. This has to be interdisciplinary and intersectional and international in scope for us to be able to do that.
Yeah, thanks, Sharon. And I think that's very true, that these corporations have a global reach from low, middle and high income countries, and there's dynamics between them as well, and operating in different environments. And I noticed that Gwyn says she'd love to hear more about the cracks when there's time. I'm sure we can do that, Gwyn. And that just brought to mind Leonard Cohen. There's a crack, that's where the light gets in. There's cracks that we need to look at. But I'd really like to thank Belle and Jen and Julia and Sharon for giving such wonderful presentations and insights on this whole emerging, which I find really exciting area of the commercial determinants of health. And I'd like to thank everybody who's on the Zoom for making the time, whether it's morning, lunchtime, afternoon or evening for you, it's sure. And I also hope that you've all enjoyed it. I think it's been really fantastic. And we'll let you know about our next seminars. And this will be available as a recording. So we will send it to everyone who's registered their email address with us. We will send this recording out. So you'll be able to use it. And Sharon, you've got your hand up there? No, oh, she has got a hand up.
No, I was clapping. That was a clap.
I'd really like to thank our WHO colleagues for shining a light on this. It's a really hard time for WHO. They're under a lot of pressure internationally with the US withdrawing funds and all the allegations. And it's really fantastic that you're still carrying on work about the social determinants of health, including the commercial determinants of health. So thanks, Etienne, for being here, and all your colleagues for being here. And we really wish everyone well. And I'd like our colleagues in Melbourne are in a very tight lockdown at the moment. So Jen is there, and there'll be some others online who are in that lockdown. And for other parts of the world, if you're in a tight lockdown, we also express our sympathies, because I know how hard that can be. And as Jen says, it's 2 hours more to curfew and everyone has to be in their house. Okay, well, good night, everybody. Thank you very much.
Thank you, Fran. Thank you. Good night.
Thank you.